Alright, you can see how red this portion is coming up to, how much hypersensitive the nerve is. Hi everyone, welcome to the Chiropractic channel where we try to teach, make yourself aware and educate on how chiropractic treatment is done and what are the ailments that you are afflicted with can be treated with chiropractic treatment. So if you remember from part 1, if the part 1 video will be over here, so please do take a look. He actually has a lot of problem from back and knee for the past 4 years. So I will ask him as to what problem he is facing for the back and knee. But in the part 1, we have already treated his low back and he is doing fantastic. We will be treating the knee today and we'll ask him as to what the problem is like right now.
ঠিক আছে দিয়ে তারপরে আমরা এই হাঁটুতে এই সেকশনটা পুরোটাই ছিল প্রবলেম
আচ্ছা
নার্ভগুলো
আচ্ছা
এইখানটা বেশি ছিল এখানটা হালকা ছিল
ওকে
ওটা হাঁটুতেই প্রবলেম ছিল এটাতেও ছিল এটাতেও ছিল
এটা কি 4 বছর ধরেই হচ্ছে
4 বছর ধরে
So he actually fell down in like 4 to 4.5 years back and then he started to have a problem in the knee where he did not have pain but everything was stiff and jammed up and it was making him difficult to walk including the low back. So the low back video was the first part which you would be seeing, or there will be a link in the description also. For this part of the treatment, we will be treating the knee and try to eliminate that stiffness and tightness that he has around in this region. Please take a look where he is pointing. আপনি আরেকবার দেখান দর্শকদের কথা। So in the entire quadriceps area, his everything for both the knees, everything is jammed and tight. So we will try and treat this and we will see where we go from here. So please be with us. So what we are trying to do is try to release the tension in the rectus femoris muscle, vastus medialis and vastus lateralis. If I come too close to the patella, then you see he is like kicking. So it's a reflex arc that's going on, something like this. See, look at this. So obviously he has a little bit of hypersensitivity that's going on in the femoral nerve and that is probably making all the muscles stiff in that area. So I'm going to try and release the muscles first. Then we will go to the nerves and from there we will certainly slowly go up the chain. এই জায়গাটাতে ঠিক এই যে এখানটায় ওকে ভালো বলেছেন. So he is saying that the vastus medialis muscle of the quadriceps is a little bit more tighter than the rectus femoris. So I'm doing a passive measure. According to osteopathic and chiropractic technique, you can start with passive measure but always end with an active technique so that the brain or the frontal cortex remembers what you did or what the patient did and it has a lasting effect. Alright, so now we will be doing ISTM technique where we will be trying to release the fascia and the superficial layer of the muscles and see how we are able to reduce the tightness and the stiffness that he is suffering from for the past 4 years. এই জায়গাটা বেশি এই জায়গাটা correct এই যে Alright, you can see how red this portion is coming up to and this is obviously erythema which is essentially the superficial capillaries are breaking and they should go away within like 24 to 36 hours. It should be as normal as it was before without doing anything. Fascia is nothing but when you are having like any meat, for example chicken, then the white layer that overlaps the muscle, that's called fascia. And that's what essentially I am trying to stretch out and also the superficial muscles attached to it. Alright, now what you guys know, it's like hammer time. This is one of my favorite tool of the trade to release muscles and fascia and nerves and reset misalignments of the bone. So I will be doing 2 or 3 areas over here and hit it in a certain angle to release these muscle fibers and maybe the femoral nerve which goes into the rectus femoris. You can see that how much hypersensitive the nerve is. পাটাকে তুলবেন আর নামাবেন, ঠিক আছে? কারেক্ট, একদম নামাবেন তুলবেন, ধরে রাখার কোনো ব্যাপার নেই, নামাবেন তুলবেন আস্তে আস্তে, কন্ট্রোল করে করে পুরো তুলুন, পায়ের পাতা টেনে, ধরে রাখার কোনো ব্যাপার নেই। 5 4 3 2 and 1, that's it. Okay, দেখি হাঁটুন। এখন মনে হচ্ছে বাবা এক দাঁত পায়ে কিছুই নেই। So you are able to see the change in his walk and how much free the right knee is compared to the left. It is completely free. We have treated the right knee.
তো পুরো ফ্রি হয়ে গেছে প্রায়।
প্রায় বলতে মানে আর কত কি আছে, কত
5% আছে।
Okay, so 4 years of stiffness with lots of medications and physiotherapy he has done. তো এটা মোটামুটি আর 95% চলে গেছে, 5% আছে, and we will give him customized program for exercises. আপনার কি রকম লাগছে এবারে বলুন।
আমার খুব ভালো লাগছে, খুব ভালো লাগছে, মানে কি বলবো আমি, মানে কিছু বললার আমার
ভাষা নেই নাকি? আচ্ছা, again please do remember, this is every patient outcome and feedback is very variable. Just because he had this problem and he had this outcome doesn't mean all other patients will have the similar thought process. Obviously it's a very challenging case, very complex case. He has been undergone lots and lots of medications and physiotherapy. Thank you again for watching the video. It's a pleasure. We are really thankful to bring these kind of videos to you. Please don't forget to hit the like button if you do like the video, and certainly do subscribe, share, and don't forget to comment. If you or anyone of your family do have any suffering from pain and from neuromusculoskeletal origin, don't forget to call us. All the numbers and contact information are given in the description box. Just give us a call and we'll happy to cater for you. Take care and all the best. Stay fit, stay healthy. Bye.